Okay, we're going to go ahead and get started with our presentation. Thanks again for joining us, everyone. We're just going to go through a high-level overview of the options for accessing care and your value-added benefits, but we will be giving in-depth presentations on each benefit separately in our future webinars, which we'll talk about throughout this webinar. Okay. I get my buttons working. There we go. We're going to also go a little bit over who Western Health Advantage is if you're not familiar with us, and just a little bit, as I said, on your individual benefits, and then we'll get to all of your questions. This presentation should not take up the whole hour, but feel free to ask as many questions as you like, and we'll stay here till we answer everyone. My name's Denise Gruden. I'm the Medicare Sales Executive with Western Health Advantage, and a couple of my colleagues are joining us on the phone today as well. That'd be Alyssa Kim and Eric Greathouse. Okay, so Western Health Advantage, for those of you who don't know, have been a pillar of the community and part of this community for over 26 years now. We've aligned ourselves with solid, reputable providers and hospital network, and we're a local nonprofit company. What that means is that we truly are nonprofit. We put the patients before profit, and we put 90% of all premiums that we receive back into the patient care. We believe the relationship and care should be between the member and their doctor, not the insurance company. As a member of Western Health Advantage, you have a choice in where you receive your care. So, as I said, we give all of the care to you and your doctor, so you have a choice of multiple medical groups and doctors to choose from. We just manage the plan details, and all of us work together to make sure that you're receiving the quality care and attention that you deserve. So how do you get started with Western Health? If you haven't already, you should be shortly receiving your ID card. What you'll want to do is make sure you check this very closely. And for those of you who are continuing with Western Health and joined us last year or the year before, you'll notice we have our great new logo displayed here. But beyond that, the most important part is your name, your doctor, and your medical group. So make sure you check that and that it's correct. If it's not, give us a call and we'll send you out a corrected card as soon as possible. All right. Also, if you're new to Western Health Advantage, you should have received, or you will shortly receive, your welcome packet. For those of you who have been with Western Health, I'm not sure if these packets are going out again, so what I'm going to do at the end of this presentation, I'm going to make sure everybody has it that provided an email address when you registered. If you do not wish for me to send this booklet to you via email, please put that message in the chat and we won't do that. We'll go ahead and find a way to mail it to you if you haven't received it. But in this brochure, it's very important. It provides you with details on the plans that we're going to give you an overview on today. It also provides you with phone numbers and websites for accessing that specific benefit. Okay. If you haven't already done so, you'll want to go to Western Health Advantage and create your WHA account. This is where you're going to create your account so you have a login to view all of your benefits, your claims. You can find a doctor, change a doctor, find a specialist. You can even look up your medication on the formulary at this site. This is basically your gateway to all other information you need, and it's available to you either on your computer or your smartphone 24 hours, 7 days a week. I just used mine, by the way. It's pretty easy to use. Also, if you've chosen a new provider with Western Health Advantage, you'll want to set up your new patient appointment as soon as possible so you can establish that relationship with your primary care. Your primary care is your gateway to all additional care that you need. So you'll want to do that. But if you're an existing patient coming off of a group plan or from another carrier, you'll want to set an appointment to make sure they have your up-to-date ID card information, because a lot of people go in, they forget to change it, and then they have to go through a few things to verify coverage. So you'll want to make sure that your doctor's office has all of your updated information. Okay, we're going to get into how to access care. You've got quite a few different choices. You can set an appointment with your primary care, or many of our medical groups offer teledoc services or telehealth services. So whether, WHA's provider network does offer alternatives to in-person visits. So you'll want to contact your provider's office or visit the medical group's website and learn if telehealth visits are an option. You'll have the same copay as if you were to see the doctor in person, but sometimes it might be more convenient for somebody to do a virtual visit. You also have access to our nurse line. This is the Nurse 24 advice line. If there's a medical question or a concern that you're not sure if you actually need to seek the immediate care of a doctor and you just have questions, you can reach out to the WHA Nurse 24 advice line for no additional cost and speak straight to a registered nurse in confidence. They can help you decide what your next best treatment plan might be or the next steps you need to take, whether it's to see your provider or go to the emergency room. All the phone numbers and links that we're going to be talking about throughout this presentation are listed both on the slide at the top, in the brochure I mentioned, and I'm going to email to you, and also on our website, and through your WHA portal. Let's say you do have an urgent situation, but you can't exactly make it to the urgent care. You have virtual urgent care available to you, again, 24/7. This is through actually teledoc. And if an urgent care virtual visit is necessary, you can use this service by calling the phone number that's listed in your materials, on our website, on this slide, and in the brochure that I'm going to send you. The copay is the same as if you were to visit an urgent care in person. Behavioral health. We have partnered with Optum Behavioral Health as our behavioral health provider. They offer in-person and flexible virtual care offices at the same copay as well. And if you're experiencing a crisis, there is a 24-hour phone number provided in your materials and again on the website. And we urge you to take that. These last couple of years has been a little stressful for everyone, so it doesn't hurt to have an avenue to, discuss some of those feelings we might have. Or if there's something bigger, deeper, wider, or different that you need to discuss, the Optum behavioral health providers are the best in the field. And you've got a huge network to choose from. You do not need a referral from your PCP. Now, the Advantage Referral Program, this is exclusive to Western Health members. This is a fabulous program. If you have a doctor that's in one medical group and you need to see a specialist as determined by your doctor and yourself, say you need to go see an orthopedic surgeon, but there's one that you're familiar with, they just happen to not be in your network or in your medical group. Let's say you belong to Mercy and you want to see a doctor that's in the North Bay medical group or Hills Physician. You can do that with the Advantage Referral. You don't need approval from the insurance company. All you need to access this care is a referral from your provider, and both doctors need to be participants in the Advantage Referral and be part of Western Health Network. So in other words, you can go outside of your medical group as long as it's still in our network. This is a great choice to have. I'm using this myself as well. So Perhaps you're already receiving care and you're new to Western Health. If you've been receiving care from a non-participating clinical provider, you may still able to be continue to see this doctor. You have to meet the Western Health transition of care requirements, but you can call member services or download the form right from our website and get the process going. Prescription medications. You have two options for filling your prescriptions. You can do it through the retail pharmacies, and pretty much we have a wide open network. There's everyone, we get all these phone calls for who's your preferred pharmacy. Well, pretty much anybody in the phone book. We have all the major chains and many mom and pop shops. We invite you to check out the pharmacies on our website or download a directory. But you'll be covered on the pharmacies as far as in-network goes. And then we also have the mail order. You can receive additional cost savings if you use the mail order service for prescriptions you take regularly. So that might be a route to go. If you currently have a mail order service and you're new to Western Health, you'll need to get a new prescription and contact the vendors with Western Health, and they'll help you get that transitioned over. And those mail order vendors are Postal Prescription Services. Their phone number is listed here. It's also listed in your brochure and on our website. Costco Mail Order Services. You do not need to be a member to utilize the services at Costco. And for your specialty medications, it's offered through Credina Health. Again, if you have an existing prescription used through mail order and you're new to Western Health, you'll need to get that a new prescription from your provider. So when you go to seek care, we literally have a comprehensive network of providers with those over 3,000 providers in our network. These providers are located in 7 counties throughout Northern California for individual Medicare. However, if you're part of our commercial Medicare group, you do have additional options in portions of Colusa, Placer, and El Dorado County. You just need to check your plan for details and your evidence of coverage. But for most of the folks on the call with us today, you have 7 counties in which to receive care. Medical groups within those counties and throughout our network are Hills Physician and Mercy Medical Group in Sacramento, Meritage Medical Network up in Marin, North Bay Health, which is in Solano County, and Providence, which is in Sonoma, Napa, and Humboldt County. And then in Yolo County, we have the Woodland Clinic. Again, you can see specialists in any of the networks you see here. The medical groups with a primary care referral. Within that network, there's 15 hospitals. We're proud to say that. When I started with Western Health just a couple of years ago, it was 12, I think. In Solano County, we have North Bay Medical Center in Fairfield, Vaca Valley Hospital in Vacaville. In Sacramento County, there's Mercy General Hospital, Sacramento, Mercy Hospital of Folsom, Mercy San Juan, and Methodist Hospital of Sacramento. In Yolo, we have the Woodland Memorial Hospital, and in Napa is Providence's Queen of the Valley. In Sonoma, you have your choice of Healdsburg District Hospital, Petaluma Valley Hospital, Providence Santa Rosa, and Sonoma Valley Hospital. In Marin, you have Marin Health Medical Center, and in Humboldt, we have Providence Redwood Memorial and Providence St. Joseph Hospital. So let's take a look at your value-added benefits. Again, I'm not going to go into detail on these. I'm just going to remind you what you have, most of you have in your plan. But we're going to go into in-depth detail on our future webinars. Okay, so let's start off with dental. Our dental is offered through Delta Care USA, and they offer a comprehensive benefit through one of the largest provider networks. This is a dental HMO plan, so you will have to choose a doctor. But if you received a card with a doctor already predetermined, you could just call up and change it if you'd like, if you need to. But the coverage varies by plan. So again, not all commercial plans offer the dental. So I would check your evidence of coverage and your plan details. But for our individual Medicare recipients, your plan does carry dental, unless you're in Humboldt. Does not have dental on the plan yet. Hearing aid services. Now, our hearing aid partner, you'll hear from them tomorrow. They have a great presentation, so I encourage you to please sign up for tomorrow's webinar with True Hearing. But to get you excited about that, the hearing aid benefit is offered through True Hearing with a copay of $6.99 for your standard hearing aids or $9.99 for the premium model hearing aids. You're allowed 2 aids per year. And for the non-rechargeable hearing aids, members get actually up to 83 batteries. Now, you can pay a little bit extra and get a rechargeable version of either set. But Cora, our director for True Hearing, will go over all of that with you tomorrow. Now, the hearing aid costs, again, vary by the MyCare group plans, so please refer to the evidence of coverage for specific details and coverage limits. Post-discharge meal delivery. I want all of you to take note of this. This is a wonderful program, but you have to ask for it or tell your doctor you want it. If you are being discharged from the hospital or a rehabilitation center, even if you've only been in there 1 day, our members have up to 56 meals post-discharge from the hospital or rehabilitation center. The benefit varies by plan, so check your benefit, but this is wonderful. They have balanced nutritional meals that are absolutely delicious from what I hear. I don't know personally, but I invite you to go on their website and check out the different meals that they have. If your doctor says you have to have a specific meal plan, you can go on there. They'll package up all the right stuff, deliver it to you, ready to cook, and it's good portions. So check out the Mom's Meals, and don't forget to ask if you happen to wind up in the hospital, and I hope you don't, but if you do, or rehabilitation center, when you're discharged, you have this benefit at your fingertips. Vision care. So aside from your eye examination each year, for every 2 years, you're going to have a benefit of up to $200. On the MyCare plan, it's $100. MyCare Plus, it's $200. Again, this varies for the commercial Medicare folks, so please check your plan benefits. But for individual Medicare, the eyewear allowance is provided by MES Vision. This can be used for your contact lens, your eyeglass lens, your frames. Now, your annual eye exam will be done through your medical group. So you'll set an appointment with an optometrist without a referral. You don't need a referral for your eye exam. Once you get the prescription for your glasses or contact lens, you can take that prescription to any MES Vision provider, and that can be like Target, Stanton Eyewear, Costco, sort of get a little bit more bang for your buck. Or you can buy your glasses, with the allowance that you have right there at your doctor's office. It's your choice. It just gives you a wider choice. Landmark Health Plan is our provider for acupuncture and chiropractic. Members have up to 20 combined visits per year. And again, you do not need a referral for chiropractic or acupuncture. Just go on to the website at mywha.org and go to MyCare CAM at the top there. Basically, if you go to your MyWA portal, that's your gateway to all of the links for all of these benefits. And you can find providers, services, nail it down to a specific need that you're looking for. Okay, first line essentials. The over-the-counter credits increased, I think, 80% last year when people really started using this. It is so convenient. You have $50 to $100 depending on your plan, and depending if your plan offers it. But our MyCare individual plans do $50 to $100 credit for over-the-counter things you'd buy without a prescription, like Band-Aids, shampoo, vitamins, all kinds of things you can get from a drugstore. But there's a catch. You have to, I would place your order and use up all of your credits that you have, even if you don't need it. Stock up, give it to friends, family, and then use your benefits the next quarter, because you're only allowed one order that's $30. You know, it can't be less than $30 or $35. So if you do that, then you can't call back and use the rest of your money. So just spend it all at once. You should be receiving a catalog. If you haven't, we'll get one to you. But you have to order by phone or online. All your products will be delivered to you within 48 hours too, so no need to worry about that. And these are name brand items. Okay, fitness program. Our fitness program, I call it a healthy lifestyle program, but it's actually a fitness program. It's Silver and Fit, and it's not just a gym. It's a flexible program that's tailored to your specific needs. So you can have access to all the name brand gyms, you know, like Planet Fitness, 24-Hour Fitness, Curves, things like that. But there's many boutique gyms that are included in that accept the Silver and Fit. So check it out. Check out your local gym, ask them if they accept the program, or go online to silverandfit.com and search for gym locations if you go to the gym. You also have access to over 1,500 online services, online sessions for your fitness program and workout. In addition to that, we'll give you 2 kits per year if you want to just exercise at home. And that is tailored to your specific needs again. You talk to our coaches at Silver and Fit, they'll put together the package and send it to you twice a year. There's also 48 healthy aging classes, which I've heard are real good as well. So check it out. Wellness. Okay, our wellness benefit is new this year. We have partnered with American Specialty Health, offering the Healthy Roads program. With the wellness program that's offered, you can take your personal health assessment to assist. You can take a personal health assessment to assist you in settling your personal goals. You'll have access to helpful health content and be part of a supportive community, you know, that can help you achieve those goals. This is a wonderful program. We're real excited to be partners with American Specialty Health. So in-home support, we're excited about this as well. Have you ever needed somebody just to come by for an hour every other week and clean your house or help you go grocery shopping or take you to a doctor's appointment? Well, the in-home support program provides non-clinical support. It's Papa Pals. And it's non-clinical support for our members. These companions come to your home and they'll help you with these household chores or transportation or even getting your meals ready. There's so much more. They are not medical. They don't provide medical services. They know basic CPR and things like that, but this is basically companion program, and it has been widely received. Depending on your plan, you'll have 60 to 90 hours per year, and it is not available on all plans. So again, check your evidence of coverage. But this is a wonderful program, and I really want to encourage you to use it. Who doesn't want their house vacuumed? Okay, Assist America, another one of my favorites. With Assist America, this is in addition to all of your benefits. This is a program that will help you. If you're 100 miles or more away from home, that's visiting the grandkids down in Southern California, you'll have emergency assistance with, say, filling your prescriptions if you lost them or forgot them. If you need to seek emergency medical attention, they'll help you find a provider or hospital. What if you're traveling abroad now that we're, traveling again, and you need to replace your passport. They'll help you to the nearest consulate or embassy, or even if you are out on the town and need a good restaurant recommendation, they're good for that as well. What's great about this is there is an app that you can download right on your cell phone and have access to this it's a command center. So if you lost your luggage, or you want something great to eat, or you need emergency services, Assist America will come through for you. So our diabetes management program. This program, it actually provides you with experts to help you manage your condition through support and education. With the individual MyCare plans, select insulins are also included. So basically, the insulins on our plan and in our formulary are part of the Saver program, which means you will never pay more, regardless of what stage of the gap or initial you're in. You will never pay more than $35, and often it's far less than that. But just so you know, your insulin is covered under the Senior Saver program. At least most, it's select insulins. But as of right now, I think it's pretty much all of them that we offer in the individual plan, individual Medicare. So plan coverage. All righty. All of the information that we've gone through just now, again, you can access each one of these partners' links by going to mywa.org, MyCare Benefits, and it'll take you, again, to the window of where you need to go if you want to look up the acupuncture or the mom's meals or even the gym memberships. It'll take you to all of those links. So I know that this was short. I want to make sure if there's any questions. Do we have any questions, you guys? Let's see here. Don't see any. Wow, either I was really good or really bad. But I want to encourage you all to sign up for our webinars. The next two that are coming up tomorrow at 10 o'clock is the True Hearing. You don't want to miss that. In fact, I would say you don't want to miss any of these, because these are actual representatives from the partner, True Hearing, and Papa Pals on the 9th that will go into detail on how to use your plan, how to get the most out of it and make it work for you. That's why we put these in these plans, because our members were asking us for this, for these types of benefits, and we heard you loud and clear. So go ahead and take advantage of it. Make your plan work for you, don't work for it. And with that, I'm going to open it up to questions. No, we really don't have any questions. Okay. Well, can somebody do me a favor? One of you out there in the audience, would you go ahead and type something in the chat so I know that you can actually use the chat box, because we were having some trouble earlier, and I just want to make sure everybody can use it. So just say hello or hi or something. Maybe there's a problem with the chat box. Okay. Well, I'll tell you what, I'm going to go ahead, as I said, I'm going to go ahead and email everyone separately, and I will send you a copy of the welcome brochure, just in case you didn't receive it. You'll have our email so you can, let us know if there were any questions. I'm a little concerned that maybe we're not getting your questions. So with that, let's see. Okay, so chat it's working, she said. It's working on our end. I'm just wondering if the audience can chat. Oh, there we go. Okay, thank you. All right, so it's working. This looks like you don't have any questions. Well, thank you so much. We appreciate each and every one of you, and welcome to Western Health Advantage. We're glad you chose us to be your healthcare company. Have a great day.